In our medical news this morning, medical groups are suing to reverse changes to the CDC's childhood vaccine recommendations. The American Academy of Pediatrics and others filed suit yesterday, calling those changes unlawful. The Trump administration now recommends hepatitis A, hepatitis B, and meningitis vaccines only for children at higher risk, not all kids. And flu deaths are rising. Health experts are bracing for a second wave after the holidays. Mandy Gaither speaks with a pediatrician about why kids are at high risk and how to protect them.
In the U.S., hospitalizations for flu in children younger than age 18 have the highest peak weekly rate in more than 15 years. And in the latest week of data, there were 15 flu-related pediatric deaths for a total of 32 reported child deaths associated with flu this season. The CDC says 90% of those who died were not fully vaccinated against flu.
Children, especially under the age of 2, they're pretty small. And when they're still small, you get something that's just so inflammatory, like influenza. When it gets into your lungs, it causes a lot of inflammation.
Dr. Frank Esper with Cleveland Clinic Children says the best protection against severe disease is for adults and children 6 months and older to get a flu shot.
By protecting yourself against influenza, you're also protecting everybody in your family.
Washing hands and highly touched surfaces can also help prevent the spread. For young children, especially at preschool, Esper recommends an adult using an alcohol-based rub to remove germs.
Alcohol is actually a better way to clean off their hands than to use soap and water.
If a child is sick, Esper says to keep them home, and you can also consider masking.
We masked up during the first rounds of COVID. We saw flu just drop, because everybody was staying away from each other. Everybody was masking when they were out, and flu couldn't get through that.
And some other medical headlines this morning. Your skin is losing moisture all winter. Your body acts like a humidifier, releasing it into the dry air. And those long, hot showers you may enjoy, they feel good, but doctors say they're making your skin worse. Doctors say dry skin can actually be a health hazard.
Your skin is actually the barrier of protection to the outside environment, right? So if that gets dry and that gets impaired, you actually are putting yourself at risk for infection, not just the itchy, uncomfortable skin that happens when your skin is dry that can have you lose sleep at night and be uncomfortable, but you can actually get sick and get infections when your skin barrier is broken.
Dermatologists say start with a product containing hyaluronic acid to pull in moisture, then seal it with something like Aquaphor or Vaseline, and ease up on glycolic acid and retinol in the winter. They can strip your skin's barrier even more. That was a look at your medical news this morning. Coming